Good afternoon. I'm Dr. Anjali Mishra, and I'm a consultant pathologist at Lifeline Laboratory. These last 2 years have been very difficult for all of us, and we have been dealing with the pandemic of SARS-CoV-2 or COVID-19. Not only has this COVID-19 created a havoc in our health, but it has also created a havoc in our mental, physical, emotional health, along with our financial and social health. In fact, it has absolutely changed the way we live, leading to a lot of stress, mental and emotional stress, like I have said before. Now, we are all very aware of how this disease presents, how we get infected, and what are the symptoms, signs, and outcome of this disease. We know that most people who are infected with SARS-CoV-2 are going to be all right and they are going to recover. The symptoms may range from being asymptomatic to severe pneumonia and to multi-organ failure. Um, but these are the acute signs and symptoms of SARS-CoV-2. These are what happens when you get the disease, the virus is inside you, and your body reacts to the virus. Um, but what is more important is the long-term effects of SARS-CoV-2 on the other organs in our body, and that is what I'm going to talk about today. So much after we recover from the COVID SARS-CoV-2 infection, there are some people who will have persistent symptoms. These symptoms may be um, feeling of lethargy, feeling of tiredness, multiple cramps in the body, or you know um, any other symptoms which are long term and persistent. But the point that I want to make over here is that it affects almost all organs in the body. There may be long term effects of SARS-CoV-2 infection on all the organs of the body, which include the heart, the kidney, the liver, the pancreas, and the brain. Tomorrow being the World Heart Day, I would talk a little bit extra, a little bit more about the effect of SARS-CoV-2 on the heart. Now, what are the effects of COVID infection on the heart? There are two kind of outcomes of that. One is the acute outcome, and one is the chronic or the late outcome. In the acute outcome, what happens is that we develop something which is known as the inflammation of the heart muscle, known as myocarditis. Now, what happens is that the heart muscles during the infection will become inflamed, they will become infected, and they will not be able to do their complete work. They will not be able to pump the blood as they are supposed to do. Now, the presentation that we feel at this time may be that there is arrhythmia, there is excessive beating of the heart, and sometimes there may be a complete heart block, or there may also be something known as a heart attack. So this is what happens in the acute phase of the disease. In the chronic phase, there are some other effects that will happen. In the chronic phase, the muscles are damaged, the heart muscles are damaged because of the infection, and there is something known as the dilated cardiomyopathy or DCM. What happens is that because the heart muscle is damaged and there is a lot of scar tissue that comes into the heart, the pumping capacity of the heart is not good. And so the heart is not able to pump the blood out. And because of this, there is stagnation of blood in the heart and the backflow into the lungs, causing what is known as the congestive heart failure. The third thing that happens to the heart is that because we all know that there are microclots formed in this infection, because of that, there may be microclot formation and there may be blockage of many vessels. And these vessels may be vessels of the heart leading to a heart attack, or they may be vessels of the brain leading to a stroke. This phenomena of coagulation and formation of microclots continues for quite some time. Now, the question is, what do we do if one has COVID? We have seen in the recent past that there are many young people who have had COVID, who have recovered from COVID, and we have known that some of them have died or had a heart attack and died. Now, what do we do to prevent this situation? What we should do is post COVID also, remembering that it can cause problems in each and every organ. We should take special care of what we do for our heart. Post COVID, there are certain blood tests. One, you should be in touch with your clinician all the time. Secondly, there are certain blood tests which should be done time to time, which will indicate whether your heart muscles are involved in some kind of an inflammation or what is the function of these muscles. In addition to that, you should do what is known as an echocardiogram, which will tell us whether the heart is dilated or whether it's working properly, whether the valves are working properly or not. Now, the tests that we do in the laboratory are some tests known as the cardiac enzymes, CPK, MB, LDH, troponin I and T. There is another test that we do in the laboratory, and that is called NT-proBNP, which will tell us whether the heart muscles is functioning normally or is it able to pump the blood out or no. So the question is, when do we do these tests post-COVID? So right after COVID and every 3 months for about a year, these blood tests should be done. And once the echo should be done. If the echo is normal and the blood tests are normal, there is no need to repeat this. But if they are not normal, you may need to repeat the echo also, maybe twice in the year. Now, is COVID the only thing that causes heart attacks in young people? We have heard in the recent past that there have been many young people who have got a sudden heart attack and they have died, and it has come as a shock to everybody. It has been a most unexpected situation. People have been thin, fit, and yet there has been a heart attack. So is COVID the only reason why young people get heart attacks? COVID is not the only reason why young people get heart attacks. There are a lot of reasons. And there are a lot of predisposing conditions which can lead to heart attack in younger people. The lifestyle, the family history of smoking, whether you're a smoker or not smoker, and whether you're obese, whether you're not having proper physical activity. These are all conditions that can predispose to a heart attack. And this heart attack, it is a myth that these heart attacks occur in the later life. These heart attacks can occur much earlier in life. Now, the question a lot of people ask us is that when we are doing a preventive health checkup, should we do what is the right age for doing a preventive health checkup, or what is the right age to assess one's situation or condition of the heart? Should we do it when we are 40 years or 45 years or post 30? Now, the answer to that is that you need to do these investigations and check the health of your heart right when you are in your 20s. What we are looking for is these predisposing conditions that can actually tell us that, one is more predisposed, there is some damage happening in the heart. And there are certain tests that we need to do, like, for example, the lipid profile, which is cholesterol, the good cholesterol, the bad cholesterol, the HDL, the LDL, as well as the triglyceride level, which tells us what is the level of these parameters. We all know that high levels of cholesterol will lead to damage of the vessels, blood vessels, leading to atherosclerosis and leading to the formation of plaques, which will eventually cause blockage of the vessels, leading to a heart attack or to a infarct in the brain or a stroke. Now, what are the other tests that we can do? So there are certain other tests like the CRP-HS, which should also be done, which tells us whether the person is having some kind of an inflammation going on in the body. If this parameter is high, CRP-HS, which is high sensitive CRP, it will tell us that there is inflammation going on in the vessels, and that this inflammation may lead to the formation of atherosclerotic plaques, and this may then eventually lead to a heart attack. There are some other myths also people believe in, and they feel that I will have heart attack only if I have chest pain. That is not true. There are people who can have silent heart attacks, and there are people who can have very asymptomatic. It can be like a upper abdominal pain. It can be a pain in the jaw and the neck area. So anything which is like this and which is intense, one should definitely investigate, no matter what age you are. Especially in the youngsters, like I said, the testing should be done and a cardiologist should be visited as early as in your 20s. And one should rule out these predisposing conditions. And if you have them, one should be able to maintain them. There is another myth that comes up. I have a family history. My father had a heart attack. My grandfather had a heart attack. I'm totally doomed. I'm sure certainly going to die of a heart attack. But that is not true also, because this is multifactorial. You may have something in the family that comes up in the family and that is, sort of inherited. But there are external factors which can help you to avoid this. For example, you can up your activity. You can make sure that there is no inflammation. You can control the levels of cholesterol. You can make sure that you are not on the obese side. You can do physical activity, diet, whatever it takes after visiting a doctor. So that is the other thing that you do. If you have a family history, you have to be extra careful, but it does not mean that you are certain to have a heart attack. You can prevent it. The other thing that a lot of people say is that I'm having palpitations, I'm having skipped beat or missed beats. Am I having a heart attack? Now, missed beats is something, again, that you really need to investigate. Missed beats can be benign. It can normally occur in people, but it may also be due to some underlying or predisposing condition. And one definitely needs to get this investigated and to see what is the kind, how much is the missed beat? Is it, if it is an excess and abnormal and irregular, we call it arrhythmia, and that definitely needs to be investigated. Sometimes there are other non-specific symptoms that can point to the condition in the heart, and those are like you may have cramps in the legs. So when you have cramps in the legs, it indicates that there is something, it's called claudication, and that means that your vessel in the leg is being blocked. And if the vessel in the leg is being blocked, you can presume that there are other vessels also which can be blocked, and therefore you have to be a little extra cautious about the heart vessels also. Another point that I would really like to make over here is, what are the heart healthy foods? So this is for everybody, that if you want to keep your heart healthy, there are certain foods that you must have which are heart healthy, which means green vegetables, fruits, which means nuts. All these food in high fiber content, these are the foods that you must take to keep your heart healthy. What you must really avoid is red meat. You must really avoid is high trans fats, which is, when you have these samosas or you have highly fried foods, chole bhature, try to avoid all these, which are highly fried foods. So this is not good for the heart. And so try to have some foods which are heart healthy. Another very important point is that it's actually very, very important to maintain a strict exercise schedule to keep your heart healthy. The more you let it beat, the better it is, and the better it works. So that is why they say that when you're doing cardio or you're doing any kind of exercise, a simple walk is good enough for you, but make it a point, make it a daily routine that you have to do this simple exercise daily. You have to walk, you have to do some little bit of cardio, and you have to do the weight exercise also. I would like to give a warning here that it is best that before you start on any exercise schedule, you must visit your consultant, you must visit your cardiologist or your physician, and you must then decide on the kind of exercise that you're going to take. Other thing that I would like to say is that stress is another very important thing which can lead to claudication and lead to increase in the levels of your cortisol or the cortisone of the steroids that we talk, the normal steroids, and that itself can also lead to various changes in the body. So try to meditate, try to have a structured life so that there is less and less stress, and therefore you can manage your time better, because the increase in the steroid or the cortisol in the body can again lead to various changes and inflammation in the body and eventually lead to a sick heart, which is not good. um, I would also like to clarify a little bit about what is the difference between a heart attack and a heart failure. Now, a heart attack is when one of the vessels of the heart is blocked and there is decreased blood supply to the heart. And because of the decreased blood supply, the heart muscles will die and therefore they will stop working. And this is called a heart attack. Heart failure is when the heart muscles are not working well and therefore they are not able to push the blood out, and there is stagnation of blood in the heart and there's a backflow into the lungs, causing edema in the lungs or the collection of water in the lungs. That is what is known as heart failure. Now, these are two different things. One very important point that I would like to make here in relation to COVID, and also without COVID, is controlling your diabetes. Heart cases, heart disease, heart attacks are more in patients who are diabetic. In relation to COVID, I would like to say that because COVID also affects the pancreas, there are many youngsters who have become diabetic at an early age. And when the sugars are uncontrolled, there is inflammation in the vessel, and there is therefore more chances of having a sick heart and having a heart attack. So, if one is diabetic, it is extremely important to manage your diabetes, to make sure that your blood sugar levels are in control. If there are any questions, I would be happy to answer those questions. And you can even leave your questions afterwards, and I can answer them by email. Thank you very much for joining us here today. What's the question? There's a question we have. There's a question which says, is heart disease an irreversible condition? Now, heart disease depends on the extent of the heart disease. In the early phases of the heart disease, it can be reversible and the heart muscles can come absolutely to the normal. But if there is infarction, then this condition becomes irreversible. More and more muscle dies, and then this condition can become irreversible. There is another question, which is, what is the role of family history in early heart attacks? There is a role of family. There is a strong role of family history. People who have a strong history of heart attack in the family are more prone to have heart attacks. Now, like I said before, it's not that they are doomed. If they take special care of their heart, they do the right things, they have the proper lifestyle, they will be fine. They will not have the heart attack. But yes, the family does have a role to play in the heart attack. Thank you very much for joining us here today. And be healthy, look after your heart, do the right things. have the right lifestyle, do not stress yourself, and needless to say, wear a mask, wash your hands, and keep a social distance. Thank you.